Dear students, today we'll discuss a topic which is often seen after a very common surgical procedure, that is inguinal hernia surgery. Now that is, let's see here, this one, inguinal hernia surgery, also there is a discharge here, rather little yellowish. See that yellowish color is there, not a serious discharge. That means it's infection. So it is a wound infection after open inguinal hernia surgery. So you have to remember, it's a clean surgery. So you have to know why it is infected. So infection is dangerous because mesh you are kept. Anywhere infection in the mesh area, mesh may come out, mesh may get extruded. So infection may be due to precipitating causes like diabetes mainly, or other general factors like anemia, hypoalbuminemia. Then of course local factors, technical factors, and more than that, asepsis, improper asepsis, and wound infection as such. So some bacterial infection, maybe gram-positive, negative, gram-negative like Klebsiella and Pseudomonas, and that will cause a lot of problem because mesh is there. Mesh may get extruded. Once mesh get infected, and it is difficult to keep the mesh in place. By whatever the antibiotic could wash to the wound, eventually mesh will get extruded. Mesh need to be removed. Mesh removal is the only usual treatment which is required in such patient. Best thing is prevent infection to occur. So proper asepsis during surgery and post-operatively is the most important thing in Liechtenstein's open hernia mesh repair or inguinal hernia. That is the point which you have to remember always. Wound infection after with the purulent discharge, see that pus is there, not a serous discharge. If it is serous discharge, would not have worried. Just to give a serous fluid collection. So persistent problem is persistent sinus perforation, mesh extrusion, recurrence. If at all it has healed, recurrence is tend to occur. There's a problem. So infection is the most dangerous thing, most common cause for infection, recurrence, remember. So discharge for culture, antibiotic coverage, sometimes IV antibiotic you have to give, image of the groin and abdomen, maybe MRI, blood counts, regular dressing. If still the wound is not healing, wound should be explored and often requires removal of the infected mesh. That's the most important. The mesh which got infected, one won't be able to get away with that easily. Remember, you may not remove it eventually in such a patient. So prevention of infection is the most crucial thing in these patients. It's a point which is very important, which you have to remember. All asepsis is most crucial in hernia surgery or any hernia surgery when you place a mesh. Asepsis. During surgery, post-operative. It's the most important thing you have to remember always. So other complications of Liechtenstein's hernia repairs, inguinodynia, post-herniotrophy hydrocele. Inguinodynia is injury to the ilioinguinal nerve or entrapment of the ilioinguinal nerve and ilioepigastric nerve into the mesh because of the chronic groin pain, discomfort, distressing pain along the distribution of nerve in the groin, in the inguinal region and the scrotal region. It's called chronic groin pain or inguinodynia. Sometimes you may have to go in and cut the inguinal nerve, reassurance, analgesic, drugs, all the things are helpful. And sometimes you may have to do a resurgery of removing the nerve, cutting the nerve and burying the proximal end of the nerve into the muscle. So it's very distressing complication is inguinodynia. Recurrence is not common after mesh, unlike in a tissue repair and mechanism repair. Recurrence is common, whereas here inguinodynia is the most distressing complication. Post-herniotrophy hydrocele is many because of the disruption of the lymphatics. Hydrocele can occur in this patient, which independently should be addressed and treated often surgically. Like any other hydrocele as such. So answer the MCQ. The deep ring is located in transversal fascia, peritoneum, external oblique muscle, internal oblique. Put the right answer in the comment box. I will get back to you. The Gilbert's classification of groin hernia type 6 is hernia through internal ring with more than 2 finger breadth, direct hernia, pentaloon hernia, femoral hernia. Again, find out the answer. I will tell the right answer later date. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic. And principles of examination is good, and differential diagnosis in the table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination. Remember, and many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn. Very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers a theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations, and you should worldwide also, actually, including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB Operative Surgery Atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything, with around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very useful for postgraduates. So not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book. I will memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step-by-step with illustrations. And my SRB is Atlas of Tissue Approximation, small book, Atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. If your daily lectures are there, live sessions are there. My Digihour lecture through JP Publishers, around 220-hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well, and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.